Take your one hand on the forehead. Your fingers, these two fingers, pinch the nose. Right? This hand, hold the chin. Open the mouth. Right? Close the air that can rise the chest. So just provide any protective device. Are you okay? If you have the mask, use the mask. At the same time, only open the airway, close the air. 1, 2. Make sure the chest rise when you go there. Are you okay with this? 2 minutes, mouth to mouth, mask to mouth. Are you okay? Now, the third method is using a ventilation bag. If you are in the hospital or you have this around, just make sure you use it to provide ventilation using a bag mask device. This is called what? As healthcare personnel, the correct name for this is bag mask device. BVM. BVM. The bag. This is the bag. This is the mask. This is the device. Bag mask device. Right? Or a simple name, maybe ventilation bag. Ventilation bag. Right? But ambu bag is a local name. So use it and hold it. You use what we call a technique, CE technique. Your fingers have a C, have a E. The C over the mask. The E hold the jaw of the patient by the side. Open the airway and breathe for the patient. 1, 2. Right? Just squeeze the mask. 1, 2. The air will go in. Are we okay with this? If you are managing a respiratory arrest or gasping patient that has a pulse, are you listening to me? There is possibility that the patient will only have respiratory problem, but the heart is pumping blood. Kungani? The heart is pumping blood, but the respiration is either gasping or no respiration. So if you find that patient, what do? Give him rescue breathing. How do you give rescue breathing? You give him rescue breathing by giving him one breath after 5 to 6 seconds. Interval of 5, 6 seconds, give him one breath. Are we okay? It's clear? They'll give him 1, 2, 3, 4, 5 breath. 1, 2, 3, 4, 5 breath. 1, 2, 3, 4, 5 breath. You continue giving him breath. Just keep breathing continuously, interval of 5, 6 seconds. And somebody, if you have a second person, let him be checking for the pulse. Like my friend here is checking for the pulse. So I'll continue giving my breath. 1, 2, 3, 4, 5 breath. If the pulse stops, he will tell me there is no pulse. Then I will now switch to what? Switch to CPR, management of cardiac arrest. Are you okay with this? So if the patient is having a respiratory arrest or gasping respiration, give him rescue breathing. Rescue breathing is giving one breath, interval of 5 to 6 seconds, continuously, and be checking for pulse. If you are alone doing it, I will continue doing it, and every 2 minutes, I will stop. I will come and check for the pulse. If there is pulse, I will resume my rescue breathing. If there is no pulse, I will continue with CPR. Kungani? Is clear? So this is about breathing. So there's what we call a compression ventilation ratio. CPR means cardio, heart, pulmonary, the lungs, resuscitation, reviving the heart and the lungs. So now you are reviving, if it is a cardiac arrest, you are reviving both the heart and the lungs at the same time. Are you okay? You revive the heart and the lungs at the same time. So you provide what we call compression and ventilation. compression and ventilation. That is CPR. Are you okay? So, in what we call one-risk cure CPR, if I'm alone resuscitating a patient, I should give 30 compressions. I stop, I give 2 breaths, 30 compressions, 2 breaths, 30 compressions, 2 breaths, 30 compressions, 2 breaths. So the compression ventilation ratio is what? 30 compressions, 2 breaths. If you are alone. If you are managing adult patient. Okay, are you okay with this? This compression ventilation ratio, it cut across adult, child, and infants. You know who is a child? Who is a child? Who is a child? Do you know who is a child? Hello? Are you sleeping? Two people doing the resuscitation, it remained the same 30 compressions, 2 breaths in adults. Are you okay with this? In a child and infant, the compression ventilation ratio, if you are alone or a one-risk cure, is 30 compressions, 2 breaths. But if it is more than 2 people, the compression ventilation ratio is 15 compressions, 2 breaths. 15 compressions, 2 breaths. In a child and infant. Are we okay with this? Hello? Yeah. But in neonates, we will not talk on neonates. Neonatal resuscitation is a different program under resuscitation. Their resuscitation is so special. Their own resuscitation is different. Are we okay? So now, compress. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. Okay, you continue doing this until you have 30 chest compressions. That is in adult. If it's a child, and maybe the child is small, you use 1 hand chest compression. Right? 1 hand chest compression. 1 hand chest compression. This is the compression technique. In adult, 2 hands chest compression. In a child, 1 or 2 hands chest compression. In a bigger child, you can use 2 hands. Okay? Good. So in an infant, you use 2 fingers chest compression like this to compress the chest. Right? 2 fingers chest compression. If you are alone. But if you are 2 people resuscitating a child, or got TJ stand by the head, and I'm the one doing compressions, I take the baby, my fingers crossed in the back, holding the baby, my 2 thumbs at the center of the chest. Then I compress the chest like this. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Then TJ will give 2 breaths. And I will continue with another 15 cycles of compression. Are we okay with this? Are we okay? So this is the compression technique. This technique is known as 2-thumb encircling hand technique. 2 thumbs. 2 thumbs what?
Encircling hand technique.
Hand technique. This is called 2 fingers chest compression. That is management of CPR in infants. Are you okay? The last is about choking. Somebody who choked. Somebody who is eating maybe some food. Maybe you're taking sweet or eating granuts and maybe making a lot of discussions, noise, talking. You know, people that choke mostly are people that are usually eating and talking. And they easily choke. and there is a life-threatening situation. If that object cannot be removed out on time, the victim can die within 2 minutes. The victim can die. Are we okay with this? So, what is the management of choking? Hello, Madam Bakulabari. Let me give you a story. There are some friends. They are hospital staff. It's a guy and a lady. They were sitting there to start an arrested heart. The heart stopped. But if you shock the heart will come back. It just has, look at it. It has on and off and a shocking button. This is the on and off. Okay, this is the on and off. This is the shock button. Let me on it. Let's hear what the machine will say.
If the patient is a child,
Can you hear?
press the child button.
Can you hear the voice?
Remove clothing from the patient's chest. Remove packet and apply pads on the patient's bare skin.
3 rules.
Apply pads as shown in the pictures. Remove packet and apply pads on the patient's bare
You hear all this? So we are going to use this so that we see how to use
as
it.
shown in the pictures.
Teacher, choose it.
Remove packet and apply pads on the patient's
This is
bare
a pad.
skin.
Apply pad as shown in the
Apply
picture.
pad as
You follow
shown
the
in the
diagram
picture.
and apply the pad.
Remove packet and apply pads.
He's
on
now
the
applying the parts of the patient bare chest. Not on a shirt, on the patient bare chest.
skin.
Patient bare skin.
Pads firmly on skin.
You see, press firmly on the bare skin.
Touch the patient.
Do not touch the patient. Analyzing. Do not touch the patient.
Do
Analyzing.
not touch the patient. Analyzing.
Do not touch the patient. Analyzing. Now it says shock advice.
Touch the patient.
That is shock algorithm.
Everyone clear.
Everyone clear.
Press the flashing shock button.
Press the flashing shock button.
Press the shock button.
Press the shock button now. Now I will tell them. Everybody clear. Everybody clear. Don't touch the patient. I'm going to shock. I'm going to shock now.
Shock delivered.
Shock delivered.
Begin CPR.
Begin CPR. The machine will ask you to begin CPR. And at 2 minutes exactly, the machine will tell you again, stop CPR. Analyzing. It will analyze the patient within 10 seconds. If it's a shockable rhythm, it will tell you shock the patient. You will shock the patient again and you continue CPR. And if you are lucky, the first shock or the second shock, the heart can come back. Are we okay? Yes. So just learn, put it on, listen to the voice of the machine and follow the instruction of the machine. That is all. CPR, continue. 2 minutes, the machine will stop you. It will analyze the cardiac arrest. Either it's a shockable rhythm, it will tell you shock the patient. If it is a non-shockable rhythm, it will tell you don't shock the patient. Continue CPR alone. Kungani? Can you take one moment? Take one moment. Let's practice. Let's practice.
That's compression. Heel of the hand at the center of the chest. Only the heel.
Yeah.
Place the heel.
Hello.
Only
Get
the
this.
heel.
Hear the sound? Kick, kick, kick. 10. Can you count? 11, 12, 13, 14, 15, 16, 18, 19, 20, 21, 22. Right?
8, 9, 10, 11, 12, 13, 14, 15,
Give
16,
two breath.
17, 18, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Give 2 breaths. Give breaths. Give breath. Don't wait. Give the breath.
3,
Pinch the nose.
5, 6, 7, 8, 9.
Hello. Only 2 and you continue the CPR. Right? When you are giving your breath like this, the hand hold the chin. Try it. Try it. Pinch the nose. Pinch the nose. No, not like this. Hold the chin like this. So put your mouth here. Watch for chest rise. Watch for chest rise. Blow in air. 1. Remove your mouth. Give the second one. Good. Continue the chest compression. Have you done it?
Come together.
Only the heat.
22, 23, 24, 25, 26, 27. One
This
breath.
one,
Second
this
one.
one. Two.
Two breath. Yes, yes, thank you.
Okay, continue.
One.
So you see, they are giving what 30 compressions, 2 breath. 30 compressions, 2 breath, right? That's good. From here, let's have 4 people again. Let's have 4 people. Yeah, 1, 2, 3. Yeah, come over. Come on.
We sincerely appreciate your tireless commitment to our participants and convention in general. I know it is not easy. We have been discussing it day and night that we want to get the chapter. This is a word of excellence proudly presented to Nasane Adamu with great appreciation and deep gratitude for your outstanding mentorship contribution for the society. Thank you, sir.